Hi, I'm Dr. Wu from the California Center for Reproductive Health, and today I'm going to talk about one of my favorite topics, egg freezing. So thanks to a lot of media blitz and savvy friends, a lot of people have already heard a little bit about egg freezing, and I just wanted to kind of go through some of the more common questions that people ask and have about this topic, okay? So the first question, who should freeze their eggs? So my answer is really anyone and everyone, okay? So this whole field actually started it was intended for reproductive age women who were diagnosed with cancer, who wanted to freeze their eggs prior to having chemotherapy that could essentially destroy their egg reserve. But now it's really available to every woman who is interested. Some of the more common reasons women come in would be really mainly lifestyle, things. So maybe they're in a very demanding career, and having a pregnancy and children just really is not the right time. Other patients come in because they just don't have a partner yet that they're ready to build a family with. And I have other patients that are coming in because, as you know, most women are having their first child older. So, and they know they want to have a large family. So sometimes they want to just come in and kind of build a little bit of a reserve, so that they can plan for baby number 2 or baby number 3 in the future. So there's a lot of different reasons, a lot of different, people have their own personal reasons why they want to come in and consider egg freezing, but I think it is a wonderful another question is, why should I consider freezing my eggs? So freezing eggs, I think, is a way to provide a little bit of buffer or insurance, I kind of think of it, so that it prevents you from rushing into life decisions that you're not ready for. And it doesn't necessarily mean you will need to use them, but it gives you an option of whether or when you want to have children. So, and the reason this is important is because women are born with a limited number of eggs. So there is no regeneration of eggs, or growth of new eggs, and that reserve only drops with age. So as you get older, the quantity and quality drops. So if you're thinking of having children later in the future, it is possible that freezing your eggs is the best way to kind of preserve that potential. So another question that leads us into is, when should I freeze my eggs? And this is a really common question that patients have. And I kind of think of it that, your peak chance of getting pregnant or your peak fecundability is around age 30, okay? And so after age 30, your ovarian reserve drops, so the quantity and the quality of the eggs drop. And then around age 35 to 37, there's a much steeper decline in your egg count and egg quality. And so this means it's harder to get pregnant. But with the quality issue, there's also more and more chromosomal abnormalities after age 35. And so this means it's actually more likely that you will have an abnormal embryo that could potentially lead to a miscarriage. So it's harder to get pregnant, it's harder to stay pregnant after age 35. So I usually, in general, recommend women to start, really considering their egg freezing between the ages of 30 to 37, when you can really make use of the healthiest batch of eggs that you have. So I generally recommend women to freeze their eggs between the ages of 30 to 37. So you can make the use of your healthiest and largest batch of eggs so that you can use them in the future, okay? For some of the younger women or women, in their early 30s that aren't quite ready yet for something, that feels pretty drastic, like freezing your eggs, I do recommend you to come in and have an evaluation either by a reproductive endocrinologist or by your gynecologist, just to check your ovarian reserve, to check the health of your ovaries, because other chronic medical illnesses or other reproductive things might come up that might tell you that you should freeze earlier, or that you might have a healthy ovaries that you can wait another year or so. So I think at least for an evaluation in your early 30s is really reasonable, okay? And then for the other set of patients who are a little bit older, who have decided on egg freezing a little bit later, for sure come into a reproductive endocrinologist so that we can do a thorough evaluation. It's possible that, depending on the health of your ovaries, that we might need to do more than one cycle of egg freeze to have enough of a supply so that we'll have a successful live birth in the future. And then I've also had patients who come in a little older, and we start discussing, and they realize that, you know what, they really are ready to have a child actually, and then they go down the route of conceiving. So I think, you know, the treatment has to be really individualized. I think this is a good time for a lot of patients to think about what's important to them, whether it's just to have this option and possibility in the future, or if you're really at this point ready, and then we can kind of talk about that. So then if you're ready to take the plunge, what does the process involve for egg freezing? So the first thing is you do come in, you have a consultation with you know, one of us, and then you actually will get some blood work done and a transvaginal ultrasound to look at your ovaries and the health and reserve of the ovaries. And then usually with the start of your period, we're ready to start with injections. Now, this is the not so fun part. This is the part where you hear about doing injections 2 to 3 times a day, and you're doing it for about 10 days total. And during this period of time, you do have to come to the clinic for evaluation, maybe around every 3 days or so. So really block out a 2 weeks period of time where you will be seen pretty frequently in the clinic. The egg retrieval will happen at the end when the eggs are ready, and it's a small outpatient procedure for about 30 minutes. You will have anesthesia, so you will be asleep, you don't feel anything, you don't remember anything. And essentially what we do is we just retrieve every egg that has been growing, okay? Then the embryologist will assess for the maturity of the eggs, and then the eggs get frozen, so they get vitrified. This leads us to the next question, which a lot of patients ask, which is, you know, how long can these eggs be frozen for? So we use a vitrification method, which means it's flash frozen. So these eggs are essentially put into liquid nitrogen, and they're frozen in a glass-like state, so they don't have any water crystals, they don't break, they don't get damaged, and they can be stored for 5, 10, 20 years, as long as you need for them to be stored before you use them or discard them, okay? So this is something that patients always worry about the quality, and there is no decrease in quality. Now, once you're ready to use these eggs, then we do thaw them, fertilize them, and then grow them out into embryos. So if you're ready to use them, the process is called in vitro fertilization. So the eggs are thawed, we inject a sperm into each egg, we culture the embryos into blastocysts, and at the same time we're preparing your uterus, and then we transfer the embryo into the uterus so that you can carry the pregnancy. So that is a whole kind of like second phase, and once you're ready to use them, you come back in and then kind of go through the whole process. So then the last question is, how much does egg freezing cost? And I know, you know, a lot of women who are considering egg freezing are single and working, so finances is a really big important factor into proceeding with this elective procedure. So I kind of think of egg freezing as an investment in yourself for yourself. So I think it's really important that, you know, that you really plan for this too. So egg freezing at California Center for Reproductive Health, we try to make it, you know, as affordable as possible. We only, you know, have you pay for the first part, which is just the egg freezing, and only if you come back to use them that there is the second in vitro fertilization cost. So for the cycle monitoring, the ultrasounds, the blood work, the anesthesia, the actual egg retrieval, and even with medication, it usually is only approximately $10,000. So I think for patients that are, you know, really interested for something like this to help with your future fertility, it is something that's reasonable that can be budgeted in. Okay, so thank you so much again for listening in. I'm Dr. Wu from the California Center for Reproductive Health, and I'll see you next time.